to continue learning about end-of-life care. This lesson will cover signs of impending death, care for a dying person, and post-mortem care. As a person nears dying, there are several notable physiological changes, especially with circulation, breathing, intake, and appearance of skin. The heart rate will slow and blood pressure lowers, creating cool extremities that may appear cyanotic, blue, pale, or dark. Respirations may become very irregular, referred to as Kine-Stokes breathing. Kine-Stokes respirations can be observed as gaps in breathing of several seconds, and long and labored or quick and shallow inhalation and exhalation. There may be gurgling or rattling of the lungs when breathing. Intake will decrease and eventually stop altogether, and output will follow the same pattern. Mottling, which looks like severely wrinkled and purple-bluish color skin, often occurs in dependent areas or lower legs and feet. At some point, the dying person becomes unresponsive, which often leads to the jaw opening. Although the dying person may no longer communicate, hearing is the last sense to fail. It is critical that caregivers continue to talk to the dying person as if they were alert and able to understand. Because the end of life is a very emotional time, the person needs to be supported and involved in their care as much as possible to maintain their sense of control. Interventions should center on quality of life and comfort measures. Another important aspect is including loved ones. Their level of involvement should be discussed with the client at an appropriate time when they are able to communicate and understand the conversation. In a long-term care facility, the care team has this conversation with the resident, and it is implemented into the care plan for the nursing assistant to carry out. Attention to pain is very important. Notify the nurse 10-15 minutes before you plan on providing care so they can assess the resident's pain and determine if pain medication is needed prior to assisting the resident. Repositioning should occur hourly due to decreased circulation and a high risk for skin breakdown. Incontinence care and all other hygiene should be completed in bed, and their skin should continue to be moisturized. Massage can help with circulation if it is tolerated by the resident. Due to the jaw opening and breathing with the mouth open, oral care using a moist swab should be done hourly. Consider applying lip balm or other moisturizer at the same time. The room should be quiet, and lighting should be lowered to the resident's comfort level. Scents from flowers, deodorizer, or perfumes may be more irritating than normal and should be avoided. Visiting times, as well as the amount of people in the room, may be determined by the nurse. A private area with refreshments away from the resident room should be available for loved ones to gather and rest as needed. Be aware that hearing is the last sense to go. Explain to the patient what you are doing before you do it, and be conscientious of the words being used near the patient. Encourage family members and staff members to talk to the patient, even if they are not responding. Talking can be comforting to the patient, family members, and caregivers. The nurse will determine when an individual has died and follow agency policies. If loved ones are present, allow them to stay with the person's body as long as needed for them to say goodbye. If they express any religious or cultural preferences, they should be accommodated as much as possible. For example, individuals from some cultures prefer to cleanse their loved one's body after death. When sufficient time has been granted, the nursing assistant will prepare the body for transport. When post-mortem care is provided, it is appropriate to ask the family to leave the room. You will provide a bed bath to the resident and then position them in correct alignment. A new gown should be placed on the resident. because urine or feces is often expelled when the resident is moved for transport. A clean incontinence brief should be provided after the bath is completed. The resident's eyelids and mouth should be gently closed if they are still open. A rolled towel can be placed under the chin to stabilize the jaw. Cover the resident to the neck with clean linens, leaving the face and head uncovered. Check facility policy for applying an identification bracelet. The postmortem care process can be very difficult for a new nursing assistant, or whenever it is completed the first few times. Be sure to ask for assistance from a more experienced nursing assistant, or the nurse, or consider completing the postmortem cares with another staff member to ease the difficulty of the experience.